I would 100% recommend it to anyone. Anyone that has a tongue tie or issues, I'd always be like, at least check out the program and make sure if you need it, absolutely follow through with it, because there's definitely improvements you might not realize that there are there. My name is Lamont. I pursued it because I was having some ortho relapse. That was the main reason. And then when I got into OMT in my initial interview, we also realized some other problems with breathing and sleeping. And so that made me realize there was other things that I just thought was normal that wasn't really normal.
Working with Will was a pleasure. When I met Will, he was referred to me due to some orthodontic relapse that his dentist had noted. Some of his teeth were starting to space out, and he had noticed that his front teeth were flaring a lot, and he wanted to get orthodontics redone, possibly Invisalign. And the dentist had notified him that he could have some muscle dysfunction, which is what was causing the relapse, and referred him for an evaluation. So when I met Will, his main concern was just the orthodontic relapse. And I was able to identify that he had some improper swallow patterns, he had a tongue thrust, and these things were due to an underlying tongue tie that he didn't even know that he had.
So it took about 5 months in therapy, and then weekly you get cards assigned based off of different problem areas, and they're grouped off in sections, which was really nice. It showed you where you should be focusing on different areas. And I think the biggest holdup, at least for me, was getting my surgery scheduled, which is always done for everyone else because I had to do a sleep study to get mine, and getting that scheduled. And I also work a weird shift, but it's definitely a very flexible program.
He works a crazy work schedule. He is active in the military as well as a reserve, and we were able to accommodate his flexibility, and he just did a fantastic job through the whole program.
I can definitely see a change in at least my eating and how I position my tongue. But even at my end appointment, just the statistical values of improvement showed that things I didn't even realize had improved.
We were able to correct his tongue thrust. He also was a mouth breather, he snored at night, and he had reported also that he was drooling a lot at night. He'd wake up and have a wet spot on his pillow, and through therapy, we were able to correct all of that. He was happy to report that he's no longer snoring. He's a young gentleman that's going to be getting married soon and wants to do orthodontics and correct all these dysfunctions that he had with his mouth. So he had a fantastic result.
I always felt comfortable. If there's any issues I had or concerns, it was always addressed and handled great. I realized not a lot of people knew about OMT, so I've been talking about it a lot more than other people, especially at work and stuff.
Will's case was a great success. He was diligent with his exercises, he worked hard, and he was an absolute pleasure to work with, and I'm so excited for the results that he received. If you think you or your child could benefit from therapy, please feel free to reach out to us at Cumberland OMT, and we'll be happy to answer any questions and provide a consultation and screening.